parts of the brain. The main part is the cerebrum. The cerebrum has four lobes: the frontal lobe, the parietal lobe, the temporal lobe, and the occipital lobe. And then we have the cerebellum, and then we have the limbic system, which contains different parts. One of the most important part of this part of the brain, is the amygdala, which is responsible for receiving any type of fear that coming towards the brain or towards us. And then the second part of the limbic system is the hypothalamus, which has glands in it and responsible for the hormonal actions. The third part is the hypothalamus, and then the thalamus. And then and everybody has actually in the manual that you have with you is briefly of the healthy brain of every part of the brain, and what if this part of the brain is injured. For example, if the frontal lobe is injured, this person will not be able to do any problem solving. This patient will not be able to do any abstract thinking. This patient will not be able to do any he will be impulsive. He will be having a repetition of a single thought. He will keep thinking about things over and over and over. This is part of the frontal lobe. The parietal lobe, for example, if someone is actually know how to play basketball, part of the parietal lobe's responsibility is to know how to do an eye-hand coordination, like how you can do the eye-hand coordination with the parietal lobe. Also, it's responsible for the awareness of your body towards the environment, like where you are, where the object in front of you related to you. The third part of the brain is the temporal lobe, and if this part of the brain get injured, we will be having a problem understanding the language or understanding the speech. Also, the occipital lobe, if we have any problem with the occipital lobe, we would have problem with the vision. We will not be able to see, or even we will see with a blurred vision. The second part of the brain is the cerebellum, and if we have any problem with the cerebellum, this is a patient that has no coordination, has a problem with the balance. If anytime he stand up, he will be falling down. The last part of the brain is the brainstem, and actually, unfortunately, if any injury happens to the brainstem, that's kind of very dangerous and even may lead to death. And remember that the stroke can happen to any part of the brain. It's not just the cerebrum. You can have a stroke in the brainstem, but 40% of the patients that they have a stroke in the brainstem, it led to death. I will go very quick over the blood supply of the brain. And the reason why I'm saying, or I'm talking briefly about the blood supply, because we have different arteries which supply the brain parts. And based on what type of artery is injured, then we will see the characteristics and the symptoms that the patient will have. For example, we have two main arteries which supply the brain. The first one is the internal carotid artery. The second one is the vertebral artery. The vertebral artery actually divided into two main arteries, which is the right and left vertebral arteries, which make together the basilar artery. Basilar artery with the internal carotid artery make a circle of Willis. And I will just explain or discuss only one manifestation for the middle cerebral artery syndrome, because this is one of the most common injury happening in any of the arteries of the brain, which is the middle cerebral artery, which is actually part of the internal carotid artery. And the features for this patient, we will see that the patient has a contralateral hemiparesis involving mainly the upper extremity and face. So this patient will be affected more toward the upper extremity and the face more than the lower extremity. We will also see a contralateral hemisensory loss. Very commonly, we will find an aphasia with this patient. Unilateral neglect, we will see apraxia, contralateral hemianopia. So this is the features. I'll just skip this part about the arteries of the brain. All what I need to say, and this is one of the main idea of the presentation, is any injury happening to any part of the brain has a specific type of symptoms. It's not all the same. Not all the arteries which get injured having the same symptoms. Not all the parts of the brain having the same symptoms. Same thing for the stroke with the right or left hemisphere. All of this is different types of artery syndrome. Now, what is a stroke? Just very quick and brief. Everybody here dealt with a lot of stroke patients. Just a kind of reminder or refreshment for your memory. Stroke is a sudden interruption of the blood supply to the brain. It can happen in two ways. It may be an ischemic stroke or a hemorrhagic stroke. The ischemic stroke means that there is a blockage of one of the arteries that's supplying the brain. But the hemorrhagic stroke means that there is leaking or bleeding in any of the arteries that is supplying the brain. Just remember something, that the blood is against the brain cells. So by this saying that hemorrhagic stroke is much, much dangerous than the ischemic stroke. And luckily that we have only 12 to 15% of the patients coming with a hemorrhagic stroke. So the good thing that most of the patients, about 87% of the stroke patients coming with an ischemic stroke. And as we mentioned before, based on which part of the brain injured or which artery of the brain injured, then we will see the symptoms that comes to the patient. Some just very quick stroke facts. The first one is about 795,000 people in the United States having stroke. 610,000 people of this having the first stroke, like a new stroke. About 185,000 people who survived from the first stroke will have another stroke. About 25% of the people that they have the first stroke will have another stroke within 5 years. Yeah. Someone in the US has a stroke every 40 seconds, so just be careful. I'm just kidding. Every 4 minutes, someone dies of stroke. So that's a very common, dangerous kind of disease. Some myth fact, there is no treatment for stroke. That is not true. If we call 911 immediately, if we have any symptoms of the brain, we can rescue that patient. Stroke only affects the elderly. That is not true, because actually we ourselves in our center at Southern Crescent, most of the patients that we have a stroke with us actually less than 50 years old. Stroke happens in heart. Is that true? No. Why? Because there is like some of the people knows or think that the stroke happens in the heart. If that happened, that would be part of the ischemic stroke, that the stroke will move from the heart going to the brain, but still it has to be like a brain stroke, not a heart stroke. So it's a brain attack. Okay, stroke happens for the first few months after stroke, like there is no recovery. No, stroke recovery is a lifelong. Even when we have some patients and we do the rehabilitation for the patients and they are going home, we still follow up with this patient that they get home care or even getting an outpatient clinic. After the outpatient clinic, they can continue doing gym by themselves. It has to be a lifelong kind of rehabilitation. The stroke is not rare. Actually, it's the 5th leading cause of death in the United States. Stroke are not hereditary, that's not true. Family history of stroke increases your chance for stroke. If the stroke symptoms go away, you don't have to see a doctor. That is not true as well. I will tell you why, because we will discuss right now something called transient ischemic attack. It happens within 24 hours and it may even last for a few minutes. And the patient will feel some kind of symptoms with heaviness on the one side of the body, or the patient may feel some kind of blurred vision, some problem speaking. So the patient comes to the emergency room, then the doctor sees the patient or whoever, and then the patient go home, saying like nothing happened. This type of patients has actually to follow up with a neurologist or with a doctor because it will happen again. We call the transient ischemic attack. Anybody before has patient coming with a transient ischemic attack? Okay. We mentioned that before about the types of stroke. We have a hemorrhagic stroke and we have ischemic stroke. I think we covered everything. Just what we need to know is that hemorrhagic stroke has two types. The first type is the intracerebral hemorrhage, and the second type is the subarachnoid hemorrhage. Both of them are the same as a type, but the only difference is the intracerebral hemorrhage happens in the artery inside the brain itself. The subarachnoid hemorrhage happens between the brain and the subarachnoid surface. Ischemic stroke, we also mentioned that before, and this is most of the, this is more commonly happening within 87% of the patients coming with a stroke. There is two types, embolic stroke and thrombotic stroke. Anybody knows the difference between both without looking at the screen? Okay, embolic stroke, this actually happens somewhere in the body, and then the stroke moves all the way, or the blockage moves all the way to the brain where it stopped. But the thrombotic stroke happens inside the brain artery itself. Okay, so this is the only difference between embolic stroke and thrombotic stroke. We already talked about the transient ischemic attack. Common warning symptoms, not only for the transient ischemic attack, but for the stroke patients also, that we have to be careful with any sudden weakness or numbness of the face, arm, or leg, loss of speech or trouble speaking or understanding speech, loss of vision, sudden onset of blurred vision, any dizziness, any headache, severe headache happens just all of a sudden, any mental problem happens to the patient. So we need to ask the patient any simple questions. What we will say here. If any of this happens, we have to call immediately. We have to call 911. So if the patient has face dropping, so we ask the patient to smile, and we see if the two sides are even or not. Then the arm weakness, if the patient feels any weakness, so we just ask the patient, would you please raise your arm, or the other arm, or raise the legs. Any speech difficulty, like if the patient is not able to speak, and we just ask the patient just simple questions, and just to repeat simple sentences, same like the sky is blue, can you repeat that sentence for me please? If any of this happens, any time, anywhere, we have to call immediately. Time to call. Okay? Enjoy the little things in life, for one day you may look back and realize that they were the big things. So just appreciate the small things before the big things. This is one of my favorite quotes. Okay. Anybody has any questions about anything been said for the brain parts, brain functions?